I wholeheartedly believe that God saved my patient's life. I'm Dr. Helene, and I am a board certified emergency physician. So imagine this. You're working in the ER with me, and this is your next patient. You have a middle-aged male who's coming in for acute onset of low back pain. Now, the differential for back pain is massive, okay, as you can see here. And your job as an emergency physician is to narrow it down. And quite frankly, our job as emergency physicians is actually not to diagnose your problem. My job as an emergency doctor is to make sure that what you are presenting with is not a life threat. And that's what my job is for every single patient, including this one. So your patient says this back pain kind of feels like an ache. They tried taking some over-the-counter medicines for it and it didn't really help. And so that's why they presented to your emergency department. It's kind of on the left lower side of the back. There's no trauma, no falls, no fevers, no chills, no coughing, no trouble breathing, no nausea, vomiting. There is a little bit of maybe some urinary retention, but that's pretty much about it. You look in the chart and you notice some past medical history of hypertension as well as a history of tobacco use. Your vitals for this patient are listed here. And on your physical exam, head, neck look fine. You listen to the heart and lungs, fine. You look at the abdomen is distended. Palpate the belly, it's not really tender. Now you, as an astute emergency physician, realize that something is just not adding up. Your spidey senses are tingling. That's what we say when you as a physician and something is causing you to take pause and kind of be a little perplexed, or something just doesn't feel right. Something's going on with this patient, and this patient is actually the sickest patient that I have in the department. And that's what we call your clinical judgment. And your clinical judgment is just as important as your history, your physical, and your exam, and the things that you order. Starts off in residency and then pretty much carries you throughout your career. So you, as this patient's ER doctor, you know that something isn't right. You think it's probably not just musculoskeletal, it's something deeper. So you get a CAT scan of this patient's abdomen and you see something that looks like this. What do you think this is? How do you think this happened? Is there anything that led to this? What would be your next step? What are you going to do? And do you think this patient needs to be admitted into the hospital? We're going to talk about this tomorrow, but I'd love to hear your thoughts and see your comments below. No matter what your education level is, no matter where you are in your training, no matter if you're not even in medicine or you are in medicine or if you're a student or not, I'd love to see what you think is going on, and we'll talk about it tomorrow.